Welcome to the Boundaries and Beyond podcast with Jennifer, Dr. P, and Trinity with her tooth sticking out, who's falling in asleep here. Don't want to forget to like, subscribe, hit the bell button for reminders, and don't forget to share with all those out-of-control boundary people you know.
What's a bell button?
Huh?
Calling for a bellhop? What's a bell button?
Bell button. It reminds people that you've got a new episode coming up.
Bell button?
Bell button. What else would you call it?
A button? Like?
No, there's a bell button. It's in the shape
Oh,
of
in the
a
shape
bell.
of a bell. Okay, got it.
Okay, can I go on?
Yes.
All right. So today's episode is our third episode. It's the second title of our first series of 10 titles. So this Boundaries episode is about self-care. And how does self-care have anything to do with boundaries? Well, I certainly found that out in the beginning when we were learning about boundaries. Before we had gone into our couples therapy, I was really out of control with those, setting the boundaries around good self-care. And I would often, I was a stay-at-home mom, and I felt a lot of shame around that. It wasn't a conscious shame. It was something that I kind of tapped deep down inside. It was something that, on the surface, I knew that that's what I wanted. I wanted to be a stay-at-home mom. I wanted to focus on my family. However, that isn't what society found as a honorable role at that time, or even to this day, I don't think. I didn't want to be that stereotypical woman sitting on the couch eating bonbons, watching soap operas. And so just to prove I was busy and useful and I deserved some respect, I volunteered for anything and everything that I was ever asked for. Even towards the end, it was like the perfect storm right before our recovery, because I just had my second child. I had also volunteered to teach at school full time as the art teacher. I had volunteered the second year in a row to be the president of our Wives of Doctors group. I was on a couple of different boards, helped out at church, and on top of that, we were going into recovery, and I had just gotten rheumatoid arthritis. Maybe that was even linked to all of my incredibly crazy life, things that I had going on in my life. In fact, I should have gotten a job just to take time off of all of that. But at any rate, that made me very emotionally sick, physically sick. I was just burning the candle at both ends. I had nothing left to give. And that's really what happens when you don't protect your ability to take care of yourself and to focus on yourself. It's no longer possible to give from the heart, give out of joy. It's more begrudgingly. It's easy to start taking on bitterness or martyr type mentality, or become narcissistic about how much better I am because I can do so much more sacrifice than everybody else. So at any rate, would you like to begin with what boundaries and self-care is all about, dear?
So I just want to comment on one of the things you mentioned is the resentment. Did you say feeling resentful?
Yeah.
Yeah. So one of the things that we'll talk about a little bit more in later podcasts is the concept of resentment, which is what is some expert refer to as victim anger.
Mm-hmm.
So whenever we consider ourselves to be in a victim position. So often when people, you ask them directly, do you see yourself as a victim? Most people say no. So one of the ways that we pick up on whether somebody is in a victim position or playing the victim role is things like, I can't say no, or I can't stop, or they might get offended if I don't do it. So at that point, you're making yourself a victim. And that's what a lot of the resentment is coming from. Mm-hmm. And going back to the self-care, self-care takes a lot of skill. And we learn these skills from our family of origin. Like pretty much everything that we learn culturally comes from our family of origin. Yeah, Trinity doesn't like it when she changes her position. So the concept of boundaries comes of self-care relates to how we fill our needs, and the needs are essential. Basic needs are essential for survival, and how do we manage those versus wants? The things that we want but we don't necessarily need, we don't need them to survive, but they actually bring us joy. Mm-hmm. So when people are not properly taking care of themselves, and we see this in addictions, when they're not taking care of themselves properly, in other words, they're not meeting all their needs, then they compensate with wants. Mm-hmm. For example, I would consider alcohol to be a want, not a need. Mm-hmm. So alcoholics, when they're not taking proper care of themselves, they get stressed out, they get resentful. To medicate themselves, they drink. Mm-hmm. And that is a want. So essentially and that's a good example of how people are hurting themselves in that regard. So overcompensating with that. Another common thing that people overcompensate. Now, food is a want, mm-hmm. but overeating, for example, dessert is not exactly a need. Mm-hmm. Sorry, did I say food was a want? I meant food is a need. Did I say that right?
Yeah, food is a need.
Food is a need.
But overeating is
a want. And eating junk food or dessert that's a want. Mm-hmm. So essentially, we're supposed to be eating to nurture our bodies, mm-hmm. not to medicate ourselves. Mm-hmm. So foods that are high in sugar, that kind of stuff, we're self-medicating. Mm-hmm. So when people eat nothing but junk food, mm-hmm. that's essentially they're compensating for needs with wants. Mm-hmm. Yeah. Okay. And that's what the managing or navigating how to take care of those needs is what proper self-care entails. And when you first approach people about this, when we're approaching other couples, it's like, oh yeah, I got to take good care of myself. Mm. And most people limit it to eating. So some other couples we've met eat healthy or relatively healthy. Mm. And they exercise. So that's exactly that's the extent of the needs, right? Yeah. And that when we start digging into it a little bit deeper, we find out that there's more issues, especially when it comes to needs that we can't take care of by ourselves. Mm-hmm. So that we need somebody else to help us with those needs. For example, I talked about physical nurturing. So food is a form of physical nurturing, mm-hmm. not emotional nurturing. If you're eating to satisfy an emotional need, that's a problem. Yeah.
And I know a lot about that.
Yeah, you can talk about that as well. You can maybe mention something when we get to that. Mm-hmm. But for example, if I need physical contact, I need mm-hmm. a hug, or when we're being physically intimate, it's not quite the same by myself. Mm-hmm. So I can't hug myself. Yeah. But I need my partner, and usually this is where a spouse comes along. We hug each other to meet that need. Mm-hmm. Now, sometimes people use their children for that need.
Yeah.
And that's a problem. Yeah. And we'll get to that in a later podcast. But for example, but what I'm trying to say is that we meet our needs, these types of needs, in an adult relationship. We don't use children to meet our needs. Adults are meant to meet the child's needs. If an adult is meeting their needs with the child, then that actually is traumatic. That is relational trauma. Something we'll talk about it later. We'll mention a little bit about codependence today. We'll talk a little bit about that. So, how do I identify those needs? Well, we'll go over some of them, but the main issue is being aware of what your body's telling you. When are you hungry, for example? When are you thirsty? Those are very obvious, very simple, right?
Maslow's hierarchy.
Yes.
Yes.
So,
and just to clarify that, because I think that is a good place to start. Maslow's hierarchy. Doesn't that start with like, I need to breathe, I need to, and then what comes after that? Drink. I need water, and then after that, you need food. That's survival. You need
right. And the thing about Maslow's hierarchy is that you start with the basic needs, and then you go up the hierarchy. You go up the hierarchy of more complicated needs, right? So yes, those are the basic needs for survival, which is food, shelter, food and water, shelter,
air.
Okay, breathe. That seems such like most people don't struggle with that unless they're smoking, right?
Well, but that's about that. We'll get into that later. If somebody's smoking next to you and you can't breathe, you have the right to.
That's something that's a boundary violation. But my point being is that when it doesn't take a lot of skill for people to remember to breathe. However, when they're regulating their emotions, that is an issue. So in that sense, yeah. So then clothing is essential for survival too. Yeah. So we need clothing, right? But do we need nice clothing?
Exactly.
For example, the color of shirt you're wearing with the golden embroidery, you don't need that.
Sure I do.
You want that.
How do I know that I don't need it? How do you know I don't need it?
Well, because you don't need it for survival, right?
Maybe I do.
Well, you need clothing for survival. So
what if I feel emotionally attached to it?
Okay, then you got to go into therapy.
Okay. So, well, and it's important to clarify that because some people they're very confused by, well, I need to look nice. I need to look nice because people will ridicule me or
right, and that's maybe going to the extreme. So you need to groom yourself and yes, look presentable. But can you accomplish that? Let's go back to your shirt. Can you accomplish that with just a basic shirt, one color?
Sure. Yeah.
Okay, right?
Yeah.
But you want the embroidery.
I want the embroidery.
Can you do it with just a plain white shirt?
Yeah. Yeah.
But you want the pink shirt with because you like pink.
Because I wanted to match you with your purple.
Yeah, and I don't care. So, can we stay focused on your shirt, please? So, the shirt that's pink, you like pink. You like the gold embroidery. And it matches Trinity.
Yeah.
So
no, she actually matches you. She's in purple.
Oh, what she's wearing, but I'm talking about her fur.
Oh, okay.
So
I didn't realize. Yes, she does.
So you want those things and you want proper matching, but those are not things you need for survival. Now, they might be culturally necessary, which again, not necessarily survival for you to have that particular shirt. So since it's not necessary for survival, then it's a want. And part of what that want does is that it brings you joy. And that's what those wants do, is they bring us joy, which is what give us hope, and that provides that sense of abundance that we feel when we're properly taking care of ourselves. But if instead instead of meeting those needs, you're satisfying a want. Mm-hmm. Okay, then you're overcompensated with that want, then that's when we're dealing with resentment, right?
Yeah. Are you talking about like in passive aggressive ways?
No.
Okay.
No, so it's just a lack of skill. So if I don't know that I need to be buying myself proper clothes, and I'm going to overcompensate with, say, jewelry. Mm-hmm. Okay, so I buy myself crappy clothes, or I don't buy myself good clothes, or I'm trying to remember what I was doing, but I remember after recovery, I had not bought myself new clothes in like 4 or 5 years. But I didn't hesitate to buy myself a new watch, right? So that's not, I kind of need a watch. I could use a very cheap watch just to tell time, although with phones nowadays, you don't even need a watch. But I don't need a fancy watch, right? So that's the kind of thing that I'm talking about. That would be more from a man's perspective. From a women's perspective, I mean, we can include the jewelry part of it. So no, it's not necessarily passive aggressive, but self-deprivation is what I'm getting at. So you deprive yourself of the basic needs and you compensate with a want.
Okay, so you mean your old 90s style suits that no longer fit?
Yes, those are my Ocean Pacific shirt that I had from
with holes
in it, which was very comfortable, and it just disappeared one day. But yes, that kind of stuff.
Okay. And yes, honey, that was boundaryless when it disappeared.
You mean, so you admit to destroying that? Yes. I don't think you ever admitted that.
Yes, well.
Okay, so that's where that shirt went. But it was old and it had holes in it, and I don't think I wore that out in public. Did I wear it in public?
I think you did.
Okay, so that would be bad.
Yeah.
Right? But I mostly, as I recall, I mostly wore it to sleep and to work around the house, do that kind of stuff. I might have worn it to go to the gym, now that I think about it.
Yeah.
That's what it was.
Yeah.
Okay, so
that's why it disappeared.
So that's bad.
Yeah.
So anyway, so those are our basic needs. So you were talking about Maslow's hierarchy, but basic survival needs. So food, shelter, clothing. I tend to include transportation in that. So cars. I mean, nowadays you do need a car.
Now, would you say, so what if a person is wearing clothes, they're fine, maybe they're not, maybe they're wrinkled, or, so I mean, it's helping them survive. And if your t-shirt was helping you survive, staying covered up, and you weren't exposing people, and it was keeping you warm, why should the holy t-shirt disappear? Or why would that not be good self-care if you kept wearing that?
Well, I think we're going back to the needs met. What that shirt is telling to the world is that I'm not taking proper care of myself.
Okay. So grooming is a part of self-care, would you say?
Yes.
Okay.
So grooming definitely is a part of self-care.
Okay.
And part of it is hygiene. Okay. But grooming and being presentable, nobody wants to hire somebody who looks shoddy.
Yeah.
Okay. And so, as a physician, if I'm wearing old, decrepit, if I show up to work in my OP shirt, I don't think patients are going to come back.
Yeah. Okay.
So
that makes sense because you don't look professional.
Right. So there can be a fine line between that. And sometimes there are times where needs, in case of your shirt, you have a want that meets that meets a need as well.
Mm-hmm.
So sometimes they overlap. So it's not clear, definitive chiasm between needs and wants.
It's a balance.
There is a balance, but there's overlapping.
Yeah. Well, and really, boundaries is about balance. Because again, if you're overindulging, then you're out of control with your boundaries. If you're underindulging, you're out of control with your boundaries.
You're being boundaryless.
Yeah.
Yeah. So there's a lot of overlap between these core issues that we've been talking about. And that certainly is one. So for example, you throwing away my shirt was boundaryless.
Mm-hmm. Yes.
But that doesn't mean that what I was doing was acceptable.
Yeah. We were two very boundaryless people.
Yes, we were. So that was part of our issue. Mm-hmm. So before we get into more specific needs, let's talk about the concept of dependence.
Mm-hmm.
So when most people want to consider themselves independent, right?
Yeah.
So that means that they don't depend on anybody else. Mm-hmm. But as we talked about it earlier, in a healthy relationship, we're social animals, mm-hmm. and we still need each other to be able to function properly in society. And for most of our history, as human beings, is we were hunter-gatherers. So mm-hmm. most of our best work was done in groups. Mm-hmm. So if somebody's independent, meaning they don't depend on anybody else, that can get to the point that we're dysfunctional. Now, we want to be, I think what most people really say is they want to be self-reliant enough, mm-hmm. That they're not needy in terms of
a burden
on other people. Mm-hmm. Correct. They want to be a productive member of society, but that doesn't take away the correct term is, and the healthy term is, interdependence.
Yeah.
So with interdependence, we learn to get our needs met, meet our own needs, get our needs met with the help of others, mm-hmm. and also help others get their needs met. But there has to be rules around that. Mm-hmm. So the dysfunctional terms are, first is anti-dependent. Mm-hmm. So that means I don't need anybody ever for any reason.
Needless, wantless.
Needless and wantless. Mm-hmm. Have no business working with anybody about that. That's actually quite common in men. Mm-hmm. Not that it doesn't happen in women, but a lot of men feel that way. Mm-hmm. They have to be a rock. They have to be an island. Rock is one thing. The rock is more supportive than being an island.
Yeah. Is
not a healthy situation.
Or martyring yourself. Women will martyr themselves, Like, what's that old commercial where the woman's in the kitchen and suddenly she hears everybody coming home, so she throws flour on her face, like, oh, I'm just so busy.
That's really, you're showing your age, dear.
I guess so, yeah, that's an old one.
Yeah. I don't think we had cell phones back then when that commercial was out.
No.
That's how old we are.
Oh, okay, yeah. Well, I was like, what's your point?
That's how old we are.
Yeah.
We can't, what was it? Our oldest was coming in from the driveway, and he said, there's this thing in the driveway. What is this? And it was a phone book.
Oh.
So, yeah, well, I had to explain to him what that was. Anyway, so what were we talking about? So interdependent. So there's anti-dependence, we mentioned. Mm-hmm. Don't work with anybody, don't need anybody, etc. The over-dependent, and there's actually a clinical condition called over-dependent or dependent personality disorder, where that fits that recovery term of over-dependent, mm-hmm. where a person just can't get any of their needs met. They need other people to get everything met, or almost everything.
Like a child?
Almost, yeah. Mm-hmm. And these are grown people.
Wow.
So they they can't leave the house by themselves. They can't go to the doctor by themselves.
Wow.
None of that. So, and then, I'm sorry?
That's hard. That would be awful.
Then there's the term codependent, which I think we need to clarify, because that a lot of people think they know what that means. They don't understand what that means.
Yeah.
So the term codependent comes from the 70s, from the recovery literature. So people with drug dependence would end up in a recovery center, for example. They get sober, they get clean, they go back home, and then they relapse and end up back in the recovery center or the rehab center. And at some point, somebody figured out that there's something that must be happening in the home that is contributing to the person's sobriety, or in a negative way. It's interfering with the person's sobriety. So at that point, they looked into the family structure. First, they looked at the person in relationship with the alcoholic or the addict. So the person with a drug dependence, the person in the relationship with the dependent, with the drug dependent, was called a codependent. Okay, so that's where that term comes from. You got a person who's an alcoholic and the person in relationship with them. This is the drug dependent. This is the codependent. So that's what that means.
Yeah.
And what we understand now, that the codependent is actually somebody who's very dysfunctional, is trying to control the addict or the alcoholic.
In a number of different ways.
Many different ways, right.
And so it's not the one thing that I bought into, the one thing that I was so offended by in the beginning of our recovery, when well, you're the daughter of an alcoholic, so you're naturally a codependent. I was so offended, especially because I thought, based on those reality shows, the codependent was that person that went out and bought the beer for the alcoholic, or took him to a bar, or tried to hide their beer from the neighbors, or
that's the enabler.
Yeah,
the correct term for that is the enabler.
Yeah, so that's what I thought. So that's why I was so offended. But contrary to that, simply in the simplest terms that finally made sense to me, is codependency is just dysfunctional behavior. That's all it is. And it could be, there are so many books written on this. There's hundreds, thousands of different ways you can be dysfunctional. And each of those ways of being dysfunctional is codependence.
Right. So, in essence, most of us are codependent.
Exactly. Yeah.
And it's rampant.
Even the addict is codependent.
Right. So, in the recovery literature, the addiction is the escape from the codependency, the codependent behavior.
Yeah.
So, anyway, that really is a topic for another day, but we wanted to clarify what that meant, because it's not most people understand it's not a healthy term, but it does have a specific meaning.
Yeah.
Okay. So, when we're working on figuring out about this help issue, when we need help in determining our needs, getting our needs met, getting our wants, how do we work that in relationships? And let's start by talking about intimate relationships, not between spouses, right? So the first rule is you don't ask for help if it's something that you can take care of yourself.
Yeah.
Right? So if I can take care of my own need, I don't need to be asking for help. So the most basic one is going to the bathroom.
Yeah.
Okay. Now, as we get older, we get, we kind of regress back to our childlike stage. Then, you might need my help going to the bathroom. I might need your help going to the bathroom. So that's a lovely thing to think about.
Thank God we're not there.
But that's the basic. That's the most basic form to address that, is that if I can take care of it myself, I don't ask for help.
Yeah.
I shouldn't be asking for help, because then I become over-dependent.
Yeah. It becomes your responsibility.
Right. You are responsible for getting those. By the way, we are responsible for getting all of our needs met and getting all of our wants met. But that doesn't mean we can't ask for help in getting those needs and wants met.
Yeah.
Responsibility is not the same thing as delegating, so to speak. That's a leadership term, but we'll get to that. Okay, so if somebody asks me for help, if you ask me for help, here's rule number 2. I decline if I'm going to be resentful. So same way with you. So you say, I can't help you with that. I'm busy, or I'm tied up, whatever. And we're at a point in our recovery that we understand that you're not saying no just to be mean.
Yeah.
You have a good reason for saying no. But a lot of couples see that as
selfish.
Right, and they're offended by it. So we had to work with a lot of couples around that. And by the way, the shame of asking for help is another thing.
Yeah.
So we'll get back to that. Let's not get sidetracked.
Okay.
We'll come back to that. So if I'm going to be resentful, sometimes we don't know, but let's think of an example where we say no. Let's say I have a commitment.
I mean, the other day, you had texted me and asked me if I could go pick up your food for your meals for you. And I was swamped with some tests that I was taking, and I just couldn't do it.
Right.
So I said, no, hon, I'm sorry, I can't do that right now. And
and by the way, you don't necessarily have to say anything as to what you're doing, especially when a couple's in recovery. When a couple has gone through the recovery that we have, it's understood. I understand that you're not telling me no because you're just trying to be vindictive.
Yeah.
Right? You're telling me no because your hands are full. And that's okay.
Yeah.
And that because going to pick up that food, because it's my meal plan, that's my responsibility. So I was asking for help, but you couldn't do it. That's okay. Well, at the end of the day, I went and did it myself. And that's the end of that.
Yeah.
And if I forgot to do it, then that's on me.
Yeah. And in the beginning of my, when we first started going through this, I had a huge problem with asking for help to pick up my medication for my arthritis. And it wasn't until I was in such bad pain that I couldn't walk and I couldn't take care of my kids properly that you actually got angry, because you're like, you could have asked me for help, and now I'm having to add to my work to take care of the kids because you have to lay.
Because now you're down.
Yeah, you're down. You can't get up off the couch.
Right. And all you needed to do was ask, can you help me get my medicine?
Yeah.
I'm having trouble going to the pharmacy to pick up my medicine. Can you help me out with that?
Yeah.
So the part of that important aspect is how your behavior impacts others.
Yeah.
How our behavior impacts others. So if we neglect ourselves and then we end up down because of our own negligence, then our partners have a right to be angry about that.
Yeah. And that happened a lot at work, where you have employees that come in sick and you try to explain to them, yes, that I honor the fact that you want to push through, but if you do that, number one, then it's going to take you longer to get sick, and you're also going to spread your disease.
You mean showing up to work sick?
Yeah, exactly. And spread your disease to everyone else.
Your germs to everybody else, right. Okay. So that goes along the lines of what we were talking about earlier, that shame around asking for help. And I assume that's kind of what you were experiencing, is you felt shame around asking for help.
Yeah.
And that often happens in dysfunctional families, which, by the way, just so our audience understands, we both came from dysfunctional families.
Very.
So we had a lot of work to do. So we're not accusing or making fun of anybody else who comes from a dysfunctional family. we just come from that ourselves and we understand.
Yeah.
And
we've been there.
We've been there, right? We've been there. So sometimes people are ashamed for asking for help.
Mm-hmm.
At the same time, they're not taught how to ask for help or when it is okay to ask for help. So that's part of what this whole process is about. That's when we were working with other couples. Much of it was that, like, okay, so he or she needs help. Are you able to help with this?
Mm-hmm.
And sometimes, most of the time, the spouse is like, of course I'm going to help.
Yeah.
In fact, we have to hold them back from helping too much.
Yeah.
Because it's like, okay, well, now you're getting into enabling. If you're doing that for them when they can do it for themselves, that's enabling. Okay, that's why we say, and that's the third rule, is if you're going to be enabling the other person, then you say no.
Yeah. That one came up recently with Mario. Just like myself, my two boys have ADHD. The first one, before recovery, I enabled the heck out of him. You know, every time he forgot his backpack, I'd run up to school, and then halfway home, I forgot my science book, back up to school, you know, and this went on daily. But when I finally learned to set boundaries around that, it stopped. Mario has the same issue, but it's rare that he calls me up and, well, number one, I can't think of the last time he forgot his backpack. He forgot his medication the other day and asked me if I would bring it up to him because he was in the middle of his math test. And, you know, I was just getting in the shower and my hair was all dirty and I had a million other things to do. And I was like, "Hun, I'm so sorry. I don't have time." He goes, "Okay, Mom." You know, he knew that's a boundary that, and he's not going to be resentful over it. I'm also teaching him how to survive in the world on his own with ADHD because I know there was nobody there to pick up the pieces when I forgot things. So it was on me. But luckily, my older son has learned not to lose things and forget things like he used to in the beginning when I was enabling him.
So just for kicks, how would a dysfunctional parent, you mentioned the part about you would go and get him.
Oh, yeah.
That's enabling.
Yeah.
So how would the other side of the coin of the dysfunctional parent work that way when the child called to ask, "Can you bring me my medication?"
Well, first of all, I have to ask myself, can he survive without it? What are the consequences?
No, but I'm asking, in a dysfunctional family, how would that show up? How would that manifest?
By enabling him?
No, I mean, the first example you gave was enabling.
Yeah.
So if we go with an example that is
the extreme opposite.
Right.
So in my case, I either got grounded or got a spanking or a beating.
For asking for help.
Yeah.
So the proper response for a child who asks for help in this situation is more along the lines of
empathy.
Simply telling them, "No, I'm sorry, I can't do it."
But also empathizing. "I know this sucks. You know, I'm
Right.
sorry, honey, sweetheart. I just don't have time."
So, and allow them to face the consequences of their actions and let the consequences do the teaching.
Yeah.
There's no need. The child feels bad enough. There's no need to pull out the belt.
No.
That's not going to make it better. It's not going to teach him a better lesson.
In fact, it can make it worse.
Right. And you can tell that from experience.
Yeah.
So, and they thought, from what I remember you talking about, the idea is the more beatings you got, the better it was supposed to get.
What?
The more you got beaten, the better it was supposed to get. Is that what the rationale was?
I guess it was instilling enough fear in me to straighten up my act, I guess. You know, I guess that was the rationale, that if I was frightened enough. But I was such a nervous child that it made it worse. If anybody knows anybody with anxiety or nervousness, that they just get even more forgetful and shut down when that happens.
Right. So we'll talk a little bit more about that when we get into parenting. Okay, so let's shift gears and talk about the specific needs.
Yeah.
Okay. We touched a little bit about food. So food needs to be healthy and not junk food.
Yeah.
Okay. You tell them, Trey. You tell them. Clothing, we talked a little bit about that. The clothes needs to be clean, need to be presentable and adequate to particular situations. Doesn't need to be fancy. But if somebody wants fancy clothing, that's okay.
Yeah.
All right. But if you think that you need fancy clothing all the time, or else you're going to be judged, perhaps you need to revisit that.
Yeah.
That's something to look at. I can understand if you're going to a function where there's a dress code.
Yeah.
That's fine. Or you're going to the place of work, again, dress code. But
like retail therapy is not an excuse.
Yeah, no, I'm sorry. Husbands don't buy into that. That's not a need.
That's not a thing.
No. Shelter. So having a home, and the home needs to be clean, safe, but it doesn't need to be a $10 million mansion. But having a vacation home, that's a want, right?
Yeah. And speaking of shelter, the shelter also needs to be age appropriate and appropriate to your living conditions. So if you have a toddler, you need to have safety locks, or even if you're a grandparent of grandchildren that come over, your house needs to be age appropriate. So,
swimming pools can be a problem too. So that's just, so those are all things that you have to be able to take care around the shelter. So that's a good point. Now, so those are the basic ones. What about physical nurturing? So that's, I'm going to go over 11 needs. There may be a few more, but these are basically the 11 needs. And number 4 is physical nurturing. So 1 is food, 2 is clothing, 3 is shelter, 4 is physical nurturing. So what does that constitute? So proper exercise, right? Going to the doctor, going to the dentist. Although that medical attention is actually under number 9, but they kind of overlap. But this one also refers to, we talked about hugs, right? Touch is a physical need that we all have as human beings. If you deprive yourself of that, then you're probably not being relational.
I mean, we're physical human beings. There's even that horrific story of the children, those children in an orphanage in Russia, that there was just so many of them and not enough people to take care of them. But they had plenty of food. They had plenty. They had clothing. The temperature was fine. They had milk or water, but yet they were dying and they were not thriving because they didn't have anyone to hold them.
Yeah, that's especially for infants is a big problem. Okay, so emotional nurturing. So what does that mean?
Well, I guess number 4 kind of leads into that. So I'm more of a snuggly person. You're more of a prickly person. So how do we reconcile that? And how did we reconcile that in healthy ways?
Well, I think that's still the physical nurturing, right?
Oh, okay.
The emotional nurturing is the ability to own your emotions and process them accordingly.
Okay.
So one way is when we're upset, for example, we take a deep breath, right? Just try to calm ourselves down. That's part of meditation. I consider meditation part of the emotional nurturing. So in medical terms, emotional lability or neuroticism is where somebody has unstable emotions. taking care of yourself when you're in those extremes helps stabilize that.
Okay.
Right? So
like taking a break.
Now, in my case, and a lot of men do this, and wives don't, you must not take this personally, but a lot of men need their space. When I'm upset, I need to unwind. I just need to, I can't hear my name. None of that. I need to have a little bit of downtime. I now spend it meditating, and you respect that when I come from work, and the kids do. Now, when they're little, they may not. So that's the other partner needs to be able to pick up the slack there. Or
the father is home without the wife. He needs to learn to manage those.
That's a tough one. Yeah. That's why. Yeah,
but it's not an excuse for a man acting.
No, it's not an excuse, but parenting's a two-people job.
Yeah.
And that's clearly been shown in studies that two-parent household is better than one-parent household, no question. And it helps when there's extended family around to also take some of the load. But we'll come back to all that when we're talking about parenting. But taking care of yourself emotionally when you're overwhelmed, that's the primary. That's what primarily needs. That means primarily. So when we're sharing our emotions, that's important. You tell me when you're happy. You tell me when you're sad. You tell me when you're overwhelmed. You need to be able to talk it out. Women need that more than men.
In general.
Right. Right. We're talking generalities there. So I would say you need that a lot more than I do.
Yeah. I like to share my emotions.
Yes. So then I cannot hear them all the time, especially when I get home from work.
Yeah.
You want to talk to me and tell me everything that happened, and I need about an hour before I can listen.
And that's one of the first things we learned about each other when we were setting boundaries with each other is that the first thing that I wanted to do, and I felt like I had the bigger boundary back then. I didn't realize that's what I was calling it, but I felt like I had the right the moment you got home. You take the baby. I've had this, and this, and I need to tell you that, and how was your day? And I want to hug, and I just wanted to like bombard you with, I've been sitting around all day with this baby, and I want to talk to an adult, and you were like, well, I've had 5 million people, pulling me this direction and that direction. I've had people in pain and people that are upset because of their pain. And now I come home to a wife that wants all my attention and a baby. And you needed that time to just decompress. And not only that, but you're an introvert, and it's well known, in I guess the medical literature, introverted people or introspective people need to unplug if they've been in the, surrounded by people for a while. And I wasn't allowing you that time. But the interesting thing is you get home, you're grumpy and hard to deal with, but let you go in that room and meditate for an hour, come back out and you're a whole new person. So it was worth it. It was wonderful. Little secret.
Right. So a big part of that is, like I said, meditation. So number 6 is spiritual practice, and that takes many forms. And we're going to have an episode talking about spirituality, but in essence, prayer, spirituality means, as opposed to religion, means having a relationship with a power greater than yourselves. And that comes from the 12-step literature, right? So prayer, I've mentioned meditation, which is spiritual in nature. But most people understand it as religious practice, but not everybody's is religious. So
and so what's the difference between spirituality and religion?
I don't want to get into that on this episode, but basically religion refers, and this is in very simple terms, religion refers to dogma. And church discipleship.
Or synagogue or going to the...
Right. Yeah. Right. So it's a discipleship. And it relates to the dogma. Spirituality, it's more, by the way, they can overlap. I mean, being religious can be spiritual. But for example, for me, some of the most spiritual experience for me was not in church, but it was in our 12-step meetings when we were meeting with other couples. To me, that was deeply spiritual.
Yeah. And some people have been traumatized around
the church, and I am one of those people.
Yeah.
So
it can be very triggering.
It can be triggering to some people. So my experience, when my patients are doing well, I feel that spiritual connection with them. So it's something that people don't understand that about doctors. Most of us want to see our patients do well. We often get criticized for wanting our patients to stay sick so we can get a bill. That's really, really incorrect, at least for most doctors. I'm not talking about the medical industry in general, but doctors. We do thrive when we see our patients do well, or get better or whatever, responding to treatment. That is very rewarding for us, and that is a spiritual experience. And the other one that we didn't talk about during our boundary session is the boundary practice is very spiritual in nature. And it's something we'll talk about a little bit more in our spiritual episode, which will bring around the boundaries concept as well. So number 7 is education. So number 1, food, 2, clothing, 3, shelter, 4, physical nurturing, 5, emotional nurturing, 6, spiritual practice, 7 is education. And by the way, this doesn't necessarily mean going to school. Clearly that's part of it, but keeping yourself up to date with current events could be one. Educating yourself about a particular thing that you're pursuing or you're interested in.
Making sure your children go to school or are homeschooled.
They're properly educated.
Yeah.
Right. So self-education is part of that need. So
and that can be a hobby even.
That can even be a hobby, although hobbies can be considered more of a want. They do carry some need. It can meet a need. For example, a hobby where you are taking care of in an animal shelter. You help out in an animal shelter. That may not exactly be a hobby, but like it's volunteering. Yeah. And that can...
Painting for me.
Painting, yeah, that's good. So that's functions.
Spiritual also.
And then you educate yourself around that as well. Yeah. Right?
Yeah.
You learn the different techniques, etc. So number 8 is money or finances. So this is one that people consider themselves, well, if I take care of myself financially, I'm selfish or greedy. That's really not the case.
Yeah.
That's very important. You have a responsibility to yourself and your family to make sure that your finances are healthy.
People have a lot of shame around money, and a lot of judgment.
Yeah.
We have a whole episode, maybe a couple episodes around finances.
Right, because that's part of our coupleship version. But yeah, we have we have shame around that as a society. It's like if you like to make money, so to speak, then you're greedy. And that really you need to be taking care of yourself financially first. Before you can help other people financially. And here's an example. I had a patient who were working through this, through these needs and wants, and she was telling me how much she was experiencing resentment around this. They're loaning money to a friend, and they weren't paying it back, and they feel guilty around asking for the money. They felt it was actually shame around asking for the money.
Wow.
And they were starting to get resentful. And I said, well, is this money that you needed? And absolutely, that was part of the money for the kids' college fund. So you can see how the spiral,
Yeah.
that's where one of those things where if you're enabling or you're going to be resentful, you need to say no.
Yeah.
And giving money, especially money that you can't give away, is not okay to be giving it away. This is not a $10 or $20 donation at the church.
Yeah.
This is a serious amount of money that you needed to say no. In fact, you had a responsibility to say no.
Yeah.
So we worked through that.
Yeah.
And I think they managed to have a talk with their friend and got the money paid back, and everything was okay. But the main issue is so much. She was working herself up so much around this that it was making her sick.
Yeah.
So,
Well, it's one of the top reasons people get a divorce, right?
Money,
Yeah. So there's just so much dysfunction surrounding
surrounding money. So number 9 is medical attention. That's somewhat self-evident. That's not very difficult to understand, but it is very difficult to implement. Men have a habit of not going to the doctor. Now, women do too. Yes, I'm speaking in generalities, dear. But men, it's usually they're being dragged by their wives.
Yeah.
And I often tell men, I'm dealing with elderly people, a lot of elderly people, and tell them it is your wife that's keeping you alive, so please listen to her.
Yeah.
They're keeping track of their medicines. Now, some of this is dysfunctional, but I don't get into that because this is a survival situation. If they don't take their medicines, they can end up really sick and ill.
Yeah.
But in the healthy situation, they would be asking for help. For example, if they can't remember to take their medicine.
Yeah.
If they're struggling with that, the wife helps set up some kind of mechanism where they don't forget it. And more often than not, they are going maybe a little bit beyond that. I had a patient who was very resentful because if she didn't put her husband's hearing aids on him in the morning, he wouldn't do it.
I'm sorry. That's funny.
Right. I laughed afterwards too.
Is that man ears disease?
Pretty much. That's the man ears where they can't hear what you're saying, but he wouldn't put, and I said, well, so why do you have to put him on? And she kept saying, because he won't put him on. It's like perfectly obvious. What's wrong with me?
Yeah.
And I said, well, if you let him maybe deal with the consequences of his actions for a few days, maybe, and sure enough, she went a week without putting his hearing aids on and let him, do whatever he wants with his hearing aids. He started putting on himself. But he was mad at her for not, because she wouldn't do it. But that was going back to the resentment issue. Yeah. You're going to be resentful if you keep enabling somebody.
Well, to put that in perspective, I remember when I used to get mad at you because you didn't set my alarm for me.
I actually forgotten about that.
I mean, we laugh about it now because it looks absurd, but when you enable somebody, they begin to expect that's your duty.
And you can see where there's a collapse of boundaries there, because if I'm doing it for you and you're not doing it for yourself, then that means I'm becoming your caretaker. I'm treating you like a child.
Yeah.
But I'd forgotten about that I was supposed to be setting up your alarm and you got mad at me when I didn't do it. So, okay. So dental attention is the other one. Taking care of your teeth is very important. Actually, gum disease and gingivitis has been linked to a number of medical diseases, cardiovascular disease, rheumatoid arthritis, certain forms of cancer. So that is very important that we keep up with our dental health. And then sexual needs. We're all sexual animals. We have sexual needs. Sometimes this is not one of those where if you can take care of it yourself, you should. This is a little bit different.
Yeah.
So yes, that nothing wrong with that, with taking care of yourself sexually, but certainly you miss the intimacy, and this is what this is referring to a little bit more, is that there's a sexual need there that needs to be met with intimacy.
Yeah.
So, and then gauging it. So we normally go down this list with the other couples is, do you have trouble asking? For example, let's go to food. For yourself, if you need the interdependence part, if you need help, do you ask for help or you don't ask? and then on food, clothing. I always get your opinion on what I'm buying because you have a better eye for the color and the matching and stuff like that. And a lot of men do have trouble with that. Well, I'm happy just wearing jeans and
technically
and workout shirt all the time. But
in all honesty, like color blindness is
well, that is more common in men. Yes.
Yeah, much more common in men, and they just most men in general, most men just don't have a care about that. It's not.
Yeah.
A concern.
No.
Yeah.
No.
It's not. It's not on the radar.
I don't think that's the issue. I think that could be a good excuse, like not putting your hearing aids on.
Oh, yeah.
Like the man ear. But I think men just have a little bit, I mean, not all men.
And
there's
younger men, I would say, care more. Like Diego and Mario care about how they look.
Yeah. And when I was that age, I did as well. Yeah. But I think I was, because my mother insisted on dressing me.
Yeah.
And telling me what I should wear, what I should not wear. I lost the ability to really tell. Not that I lost it. I don't think I ever gained the ability. I really realized how to dress myself well. So I'm always asking for your opinion. Now, not always, and not on everything. Like when I'm buying a new
scrubs,
martial arts ski, I'm not exactly asking you for your opinion. I really don't want your opinion in that regard. But yeah, the scrubs. I might ask you a little bit as to the fit, but not necessarily the colors, that kind of stuff. But those are easy. And like I said, men tend to be simple. So if I could wear jeans all the time, everywhere, I'd be happy with that. I'm a Texan. I'm happy with that. But that's not always that. I can't dress like that all the time. So just recently I bought myself a few suits, and I picked the color, the overall color, the overall texture. As
soon as we started talking,
when she and the
details, you're done.
And the seller wanted the details and stuff, I was out of the room. So let them deal with that. They were talking for another hour, and I couldn't believe it. Why are you still talking about an hour of my clothes? So anyway. Same thing for physical nurturing. Do you ask when you need a hug? You ask all the time. Yeah. In fact, you tell me, just assume I would need a hug all the time.
Yeah, exactly. Where's my morning hug?
Yeah, where's my lunch hug? When's my after dinner hug? So, emotional nurturing is a little bit more complicated. We do need to ask for example, I ask for time that I can take to go meditate. That kind of stuff. Is this a good time to talk, especially if something that is an emotionally charged issue that we need to address? Then we need to set an appointment. We forgot to talk about that on boundaries, that it's important to ask for appointments.
Yeah.
And then spiritual practice.
And around appointments, things like dates are important.
Oh, yeah.
Especially for parents of young children, because that's so easy to forget and get out of the routine.
Forget, right.
And then that eventually you just become roommates over time.
Yeah, so those weekly dates are very important for couples, for married couples. So one example around asking for help with education is, for example, asking for the finances or the time to, when you need time to study, then I leave you alone, let you go up in the quiet area. When I have to take my my CMEs, my continuing medical education, I ask for time, or I'm telling you I need to go to the the office to do this. Can you take care of the kids during that time? Can you take care of whatever? That's the asking for help part. Money. So for the most part, I take care of most of the finances, and it drives me nuts when you don't participate. So you've made a bigger effort now to be a part of that, and you've come to our financial advisory meetings with me as well. So that's, if something happens to me, you need to be able to take care of the finances and know how to access the all our finances. So, and then we're not gonna talk about this now, but not in detail. But just want to mention that money is a big issue when you're not getting your needs properly met.
Mm-hmm.
For overspending is a problem.
Yeah.
You mentioned retail therapy. That can be
Yeah.
a form of overspending.
Yeah.
So one's got to be careful with that.
Mm-hmm.
And
it's interesting that when we, as we started going through recovery, those things were no longer important to me. I know I still have a friend in the boutique business that's wondering where I went. I feel guilty, but I got to set a boundary.
Right.
Mm.
So, and sitting down and talking about that's part of the interdependent part, is sitting down once a month or whatever, just schedule a sit down to go over y'all's finances, or go over our finances, our household, where at least once a year to go over your,
how and your different interests too, and to have your own set income, whether that's and if you were a stay-at-home mother like I was, I got a certain amount of income.
You're talking about a budget?
Yeah, like I had a certain amount of income that was mine, that came to me every month, and you could look at it as like my salary for chauffeuring the kids all over the place.
And you have your own bank account, and I have mine, and then we have, no, I don't have my account. We have a joint account, and you have a separate account.
And that way, the partner doesn't feel like subservient or like a child going to the parent asking for money. They have their own income that they feel that is theirs. They don't, because the alternative is that, okay, if I'm going to be treated like a child, I'll act like a child, I'm with the money, and while that wasn't a conscious thing that I was doing, it was kind of a passive aggressive subconscious thing that was happening because I needed that control. I needed to feel empowered. And by having to ask for money, which is how we did it in the old days, I felt like a child, and no matter how many times you told me you're not a child, it's like, but it's disempowering. So you have to empower each other. Whoever decides to stay, if somebody decides to stay home with the kids, you have to, and might even, if it's the husband, which a lot of men are doing these days, I would say just for biological reasons, you have to be much more conscious of empowering your partner by giving them a salary as a householder, I guess, is how I like how Patanjali, the yoga, the guy who wrote the Yoga Sutras, he called it a householder. So I prefer that than housewife.
Okay. And by the way, this is something that we negotiated. It doesn't mean that every couple has to do it exactly this way. It's just something we negotiated.
Mm-hmm.
And then
there's a lot of other ways of dealing with it. Mm-hmm.
And it's up to the couple. I mean, some couples might be fine with just having a joint account and leaving it at that.
Yeah.
So medical attention, for example, if you're having trouble going to get your medications, then ask me to pick them up. If I'm having a procedure, so I've had a couple of minor medical procedures, and you drove me there, or you picked me up after that, because I was going to take an Uber.
What?
After anesthesia, but they would never let me leave the hospital that way. But if they let me, I would absolutely do it.
Oh my gosh!
But that's not okay. But that's how men think. So that's women's reactions usually. And then sex. As far as sex, we used to have a date for that.
Yeah. That kind of goes along with date night. And
right.
Every couple has different, and you need to negotiate those needs too. Where, some people may be fine with once a month, where other people want daily, so you have to negotiate that. You meet somewhere in the middle. There's not I don't think there's a bigger boundary where that is concerned. So if one person says once a month, now if there's somebody that's less than once a month, I might, see if there's something.
Yeah, once a month might still be
A little
concerning.
Anorexic, yeah.
So, and some people might say, well, that takes away from the spontaneity. No, not really, because you can still be spontaneous.
Yeah.
You can still be spontaneous the rest of the time. But you just schedule it that's your minimum, and you can have other situations.
Yeah, especially parents, because you have to figure out, well, are we going to have our parents take the kids for that night? Or are we going to have them spend the night at a friend's house?
You have to plan it.
Yeah, you have to plan.
Parents have to plan it.
Be spontaneous.
And then when they're finally out of the house, then you're past the stage.
You're in such a routine.
Yeah. So anyway, so that, I think that covers most of what we wanted to talk about in terms of needs. Mm-hmm. So we didn't quite go into the wants, but we talked about the jewelry being a want, mm-hmm. and how that helps with the needs.
I think we went into food, we went into clothing, housing.
Right. And how that, so the last thing that wanted to address was the cup of abundance. So when you have a cup, if you're not getting your needs met, this cup is going to be mostly empty.
Yeah. And
if you're trying to give and help others from that position, even your spouse, mm-hmm. Charity, whatever, like that case I talked about, mm-hmm. if you're giving from a position where your cup is pretty empty, you're going to feel that resentment. Mm-hmm. But if your cup is full and it's overflowing, which is because of your needs and your wants being met, then you have plenty to give. Then when you give from that position, that's when you start experiencing joy.
Yeah.
And that's part of what that cup of abundance, you want to fill that cup before you start giving, mm-hmm. From that. Just give from your abundance cup. So that includes, for example, donating money.
Yeah.
I mean, sure, that your tidings from the church, I would put that as a need, and include that in your financial, as part of your financial needs, to be giving to the church or whatever charity you believe in. But you don't give so much that you put yourself in a bind.
Yeah.
You have to give what you can give, mm-hmm. and I emphasize can, mm-hmm. Even if it's $1, that's fine. But you have to fill that cup, mm-hmm. or else you're always going to be feeling frustrated or resentful.
I like the analogy of being on a plane where, and this, when I first heard this, I thought, oh, that's insane, where the flight attendant would tell you when the mask comes down, first put yours on and then you put it on your child. And, but then when you hear the rationale behind it, that, you're not any good to your child if you die of lack of oxygen. So that's kind of the same concept, is if I don't take care of myself, eventually I'm going to peter out. And I've seen that a lot with young people in their 20s, where they have that servant mentality, which is very noble. But if you're giving so much that eventually that you're up till 2 a.m. and you're working your fingers to the bone, by the time you're in your 40s, there's going to be nothing left of you. So take care of yourself when you're young, and you'll last a lot longer for those who really do need you.
Okay. On that note, where did Trinity go? Did you let her down? She's still there.
Yes, yes.
Okay. So, so what is our next topic? It should be emotional. So we'll talk about emotions and emotional reality, and then after that we'll focus on shame.
Yes, and so we decided the episode that we did prior to this, we said that it was going to be family of origin, but we've switched that. So yes, we've decided to go into emotional reality, so that we'd have a foundation for family of origin. So emotional reality,
And then shame.
and then
Focus on shame. We'll talk a little bit about shame.
Yeah.
And then we'll go in a little bit deeper around shame.
Mm-hmm.
And then we'll talk about family of origin.
Yeah. Those need to be a foundation for family of origin.
Okay.
Yeah.
Well, and thank you for joining us. And hopefully we'll see you the next time. Don't forget, please like and share if you enjoyed this episode. And as Jennifer says, if you have a friend that needs to learn about boundaries and self-care, this is a perfect episode to send to them.
Yeah. All right.
Have a good night.
Thank you. Good night. You done, Trinity?